Long-term care home residents and their families try to get through this second wave of COVID-19. One of Canada's largest long-term care operators, Revera, is dealing with another outbreak at an Etobicoke home this time, where 100 residents have tested positive, as well as 50 members. Revera, which has places all over the country, has already started to look at lessons learned from the first wave in a report to be made public tomorrow. Joining us now is Dr. Bob Bell, who chaired the Revera review. Hi, Doctor. Nice to see you.
Good morning, Rosemary.
And I should make clear for people that Lisa Streifler's mom is not at a Revera home, but she does illustrate sort of the overall concerns that everyone has, regardless of the home. And there is an outbreak in Winnipeg in a Revera home called Maples. So I know the CEO asked you to review their experience by looking at this expert panel. The report comes out tomorrow. What can you tell us about the findings?
Well, you know, the most important thing I can tell you, Rosemary, is Lisa has it absolutely right, that the most pertinent finding of the Revera review, which was done by really international, national experts in public health, infectious disease, geriatrics, who volunteered their time across the country to look at the experience that Revera had to try to ensure that lessons from the first wave of COVID-19 were being applied in the second. And the most important lesson is one that Lisa expressed extremely well. That is that the risk of a long-term care home, a nursing home, being infected by COVID-19, the most important factor depends on how much virus is in the community around the long-term care, especially in the communities where the long-term care staff are living. And these folks unknowingly, in the best interest of their patients, come to work. And if they are not being tested, as Lisa expressed so eloquently, the risk of them unknowingly bringing disease into the home during a time when they're infected but asymptomatic is, you know, it's high. Mm-hmm. And that's what Revera has learned across the country. In Ontario, which started testing of asymptomatic long-term care home staff back in May, testing them every 2 weeks, and now testing them weekly if they're living in areas of high community spread of the disease. We've been able to protect long-term care residents much better. However, in Manitoba, in Alberta, British Columbia, Saskatchewan, where Revera has homes, the government has not instituted mandatory testing. Revera itself is actually contracting with private testing companies to actually do tests for their staff. And this is one of the most important things our report says that can happen to protect residents.
And I should really make clear that point, Doctor, that you were not paid to do this report, that this is something you wanted to do, and as well as the other members who came up with this report. But as you know, Revera has been under really intense pressure across the country for the way they've handled their long-term care outbreaks. So surveillance, certainly, but I imagine there are many other things that need to be fixed at Revera and at long-term care homes writ large.
Well, you know, I think that the experience that Canadians have seen develop during COVID-19 in long-term care, it's perhaps been a surprise to Canadians. The fact that 70 to 80% of Canadians who've died from COVID-19 have lived in long-term care homes. That's been a surprise. There's no question. As the second wave goes on and as vaccination thankfully arrives, you know, we'll be examining as Canadians what's happened in long-term care. We'll be looking back on the experience and saying, what could we be doing to protect residents better? But as Lisa says, the most important thing we can do right now is to be testing. And in areas of high community spread, we should be testing every day, not with the deep nasopharyngeal swabs that are uncomfortable for staff, but with saliva testing, other methods of testing that are much more comfortable.
The federal government has started at least a conversation with provinces on national guidelines for long-term care homes. Do you think that would be effective? Do you think it's needed?
Well, I think the first place to go is national guidelines on testing. It's remarkable to me that other provinces haven't seen Ontario's experience. You know, after Ontario introduced mandatory staff testing in May, protection of residents improved, and the second wave in Ontario has been nowhere as dangerous to residents of long-term care as the first wave was. In the first wave, we had up to 40 deaths in long-term care a day, Rosemary. The second wave, that number has generally been below 20. So certainly people are better protected. And one of the most important starts of mandatory requirements across the country would be for all provinces to be testing staff. And if the risk is as high as it currently is, for example, in Alberta or in communities like Toronto or Peel, to be testing every day, using saliva tests, comfortable tests, because staff don't want to be carrying disease in. They are unknowing that they're infected. They should be given an easy way to test themselves, even on a daily basis, as the best possible protection for long-term care residents.
I only have about 30 seconds, Doctor, but you know the federal government announced $1 billion just to get through this for long-term care homes. I imagine you think that's the best place to spend it, because there will be other things that need to happen, making sure that it's one person per room or that there's more space, circulation, all those things. But in the short term, I imagine you're going to tell me testing is where that money should go.
Well, there are going to be a lot of other things that we discussed in the Revera report when it comes out tomorrow. They've given us a huge amount of data, but right now, testing.
Okay, Dr. Bell, good of you to make the time today. Thank you for sharing some of what you found with us here today. Appreciate it.
Thanks, Rosemary.